So actually, let me just find, just want to get your questions. Okay. So the first contract is an original agreement, but it's continuing services. So it was put out to bid. They were selected again, SF Study Center. And so this is a new contract to procure the same, essentially the same services, which is program administration for peer leadership in DPH's Trans Pilot Project in Gender Health, San Francisco. And then the second component is also peer leadership and trainings, but it has the trainings attached to it. So they're slightly different, but the focus is peers and peer leadership, and that SF Study Center is administering the program. And so that one question about, I just lost the question about the insurance. I think it sort of goes with all the contracts. I'm not sure why it was pulled out here, except just to say that the SF Study Center in this role is program administrator. They hire and make sure that all the insurance is available to all their employees in this role. So that was providing the full complement of insurance needs, like workers' compensation, health insurance. So I didn't notice it until you noticed it, but it's a kind of a given for all the contracts. All our vendors are required to provide certain types of insurance for their employees, or a certain amount. And then one of the questions is about the retroactive nature of this. We're still digging out, and you're going to see this throughout. There's a couple things going on. One is that following the direction of the city attorney and the Office of Contract Administration, we're breaking apart contracts so that the contracts are, each contract on its own is authorized by one single authority, be it a sole source or a solicitation, but the same one. They don't like having multiple. So the pendulum has kind of swung the other way, because before we combined contracts, so we had big contracts with lots of programs and lots of different authorities within them. So this has been overwhelming this year, because our one side was super, did a great job in doing new solicitations. And so there's a lot of services, like over 50 new contracts starting July 1st that are continuing services. So it's getting caught up from that as well. And then the other thing that you'll see that's impacting, like with Instituto and some of these, any contract that's behavioral health services, which has an outpatient component, we are converting to CalAIM reporting, which is changing, which has a new template for the providers, and then this whole new calculation process, which has been a struggle to get them up to speed, get us up to speed, to get them up to speed, to be able to fill out the template, because it changes everything about the reporting and the billing. So, but anyway, so Study Center is now like well into the process. The documents are all in. City attorney's done their pre-review. So I don't anticipate any further delay on that. Regarding the federal SAMHSA grant, there is a potential loss of funding, but there's too much moving parts right now to know if that's impacted. It hasn't been flagged. And this almost all, well, I can speak for the community-based organization contracts with very few exceptions, which happen to be at UC. None of the contractors receive an indirect rate that's higher than 15%, even if it's the federal funding. So, because we keep, that's our health commission rate and our city rate, but we keep it to 15% indirect, and that's where it is. There's been sometimes when a federal grant comes and the federal grantor allows a higher indirect, and that's been the kind of argument across, or figuring it out. So we really don't have that many indirects to cap, and they're trying to figure that out too. So too many moving parts right now, but everyone has it on their radar to looking at all the federal funding. So do you have any questions for Study Center? If you do, yeah.
Yes, Commissioner?
So I have a few questions about the contract itself, and then one based on what you shared with us around the city attorney's requirement to now separate out each of the contracts to a single solicitation or
Per
yeah,
contract,
yeah.
yeah.
So is that going to create ongoing delays, or is it just a temporary delay because you're trying to catch up?
I think it's we always find something that causes a delay. It seems like there's something new every year, but I think we will catch up. There was a lot of solicitations. And so what we've been doing, and this is like where it's all like crunch, there'll be some big ones coming up, but I think we'll time them differently, maybe time them earlier than they otherwise would have run out. So we can keep that one going. So it doesn't end June 30th with the new one starting July. So we have some overlap. So that's one of the things that we'll do. But this has been, this is happening now, and all the solicitations that were done is why the impact feels so big right now. Plus, you add on the new contracts that are coming for different initiatives, and it's hard to get vendors up to speed. And so we're working on, and if that was me, but I don't think so. We're trying to relook at how we work with new vendors. This wouldn't be a new vendor, but to parse out the compliance pieces that have to be completed in order for a contract to be certified. So it doesn't get all the way to the contracts office, who then can't get it certified because the vendor doesn't have the right type of insurance. So that's where it gets checked, but we're trying to get it in place earlier. So we're doing some parsing out and early onboarding so that we can work with the vendors more effectively with a checklist, so that everyone, wherever they work in the flow, knows all the pieces. So that's something we're doing right now, and doing with, especially and kind of with the core two, the latest wave, the fentanyl ordinance, so as we work with new vendors, especially any that haven't worked with the city before, they're not inundated with, there's a lot to come into compliance with. So we want that to be really clearly documented and happen in parallel. So I think that will help. But this problem I don't see going on forever. I think this is the crunch, unfortunately. And the other thing that it backed up against is the CalAIM, and that has been an enormously heavy lift. And of course, it involves the same people, the same program staff are involved in working on that, and then the new scopes. So it's just, it's been a hard year, but I think that we're having progress. And the other thing that we're doing, the place where it's impacted the most is behavioral health services. So we're right in the beginning of 3 sessions to like go over every single contract and make sure we know where everything is and what's missing, because there's so many moving pieces and everyone has a different story, just to make sure that they're all there. And we have been having a lot of meetings with vendors, because especially when they went from 2 contracts to 8, it's confusing. And then this one has outpatient. So there's been a lot of very focused meetings with the vendors to bring, to help them actually walk them through the outpatient templates that they have to do for the first time. So I anticipate it will be getting better, but that's what we're struggling with right now.
I appreciate all of the effort, that the tremendous effort, I'm sure, that you've had to put into all of the moving parts. And I'm not sure if, especially given the concern about federal funding and how that's going to affect not just the contracting, but because, you might have to revise some things and
Right.
extend some things or cut some things off. And so I appreciate all of the work that's going into this, but would probably be good if we could get an update, just ongoingly on
With
the kinds of
status.
things.
Yeah.
Actually, with this, my question, but with all of the other kinds of administrative difficulties that may result in delays or workarounds that are going to affect vendors and contractors, particularly those that are providing the direct services
Yep.
to their clients. So would appreciate that. And then also any information about how the federal funding, either the freezes or the rescinding of funding for particularly DEI-related programs are going to affect the ones that we've already approved or those that you're going to create new solicitations for. So would appreciate that. To this particular contract, given that this is, even though it's a new contract for ongoing services, it says in the service description that the study center is going to hire several staff, but if it's ongoing services, why is it going to
Yeah.
be new staff or rehiring existing staff for the service that are already being provided by the study center? Is there somebody that can answer that question?
I don't see exactly where you're looking, but I think what it would mean is they have been hired
Under the service description,
under service
Yeah.
description.
under second paragraph? The-
Yeah. Thank you. I see it.
And
Yeah.
they also say it under the
Yeah,
third
yeah.
paragraph
Yeah,
that they're going to be hiring different
oh,
staff.
that's right. Yeah, under the,
No, it's unfortunate copy and paste. It will be continuing the services. Tracy Helton, I think, is online. I don't think they're hiring new services. New peers. I think this is the peers and they're continuing them for the same project. So it shouldn't say will hire. But I don't know. Tracy, are you on?
and for the same, the same for the second program as well.
Right.
Yeah.
Yeah. I thought.
I don't think Tracy's on, but Teresa Yu is here. I believe that the two of them were tag teaming on this. Teresa, do you have an answer to the question?
Hi, yes, are you able to hear me?
Yes, loud and
Oh,
clear.
Good afternoon. Yeah, I can just speak for my program, the Culturally Congruent Black African American Innovation, is that there will be staff continuing on. We did have a staff separation, and we have a couple of positions we still need to hire for. So yeah, it is just a combination of both because we weren't fully staffed last fiscal year.
So maybe there can be some correction on the will hire language
Yeah.
for that one. And then if we can get some clarification under the pilot project, the trans pilot project, if it's going to be continuing staff or
Okay.
hiring of new staff.
And well,
So I think as a follow-up to the question that the delay in contracts is related also in part, and several of the contracts are like that here, that are actually out to almost 6 months. How are they being funded then during this 6-month period?
Yeah. So some of them aren't. They're using funding from their other contracts to cover the
They're using
shortfall.
their other contracts, monies in order to pay
Right.
for these programs until we come up with it?
Right. Yeah. No,
Okay,
it's not.
So
yeah.
I think it's really urgent to have this timeline that we're looking at because, not every agency can afford to do that. And as we've seen.
Yeah, and not other funding sources might not allow it. So
Right. So I think rather than hearing, as we do understand that this is just swinging the pendulum totally the other way, where we were combining contracts to make it simpler for everybody. And now the guidelines are that we can't do that and we have to unravel that. We need to make sure that our CBOs aren't really on the hook for these extra dollars that are a continuity of program for us and benefiting the recipients, but it's not benefiting the organization, which
Yeah.
we need in order to maintain these services. So I think one, if you can give us a timeline more specifically about when we think we're going to straighten this out, or are we constantly going to have 6-month delays? And two, what are the ways we're going to try to fund these people, if possible, in the interim?
Right.
Or, but if we can more quickly resolve this administrative problem, then we don't have to worry about problem number 2.
Yeah. So just a couple things. There's we're working really closely with the vendors that are like having immediate cash flow. So that's one, which great. I mean, I don't disagree with one thing that you're saying. It sucks. It's awful. And it is like the worst case scenario. But what we're doing is working very closely with the vendor, trying to expedite. A couple things we've done too is like if a vendor has the same service last year and this year, but they haven't done their new outpatient template because they can't, or it's been too hard, or whatever the problem, then we've pushed through contracts to certify them based on the old template so that we have cash flow. And that just allows us to continue to pay them based on their old rate or previous rate, previous model, and then we do a cleanup and make the adjustment. So that's one thing that we're doing for cash flow. The other thing is that when vendors have a certified contract, to the reason this one is bad is because everything's restarting July 1 or whenever. Some aren't July 1, but they're restarting July 1. But if, let's say you have a 5-year approved contract and you're in year 2, that same lag could be happening, but what we do is we automatically have a process set up that you continue to get paid based on your prior year contract. And this is, we call it MYE. This is for behavioral health services, so that that problem, the cash flow, it's the remedy is built in. We hope to get past the need to use the prior year budget, because it's just more work. Then you have to do the adjustment and, but we have that. So we are able to keep cash flow going for vendors that have certified contracts. So the problem is really these huge handful of July 1st contracts, but happy to come back. We are doing that. I told you that update. So we'll have a better picture of the whole timeline and where we are with each of them. So happy to share that next
Okay.
month.
No, I think, we recognize this was not a problem internally, but we are concerned to make sure that we're making every effort, even while we're not. We have small cost of living increases for them.
Yep.
And we know that some of them are really small and not
Yep.
able to sustain without a cash flow.
Yep.
So, okay, I think we can move on to our next contract. It was important to get those issues out on the table in general, and I really appreciate the work that your group is all trying to do in order to make this work, and appreciated the added explanation.
Sure. Okay. The next contract.
Oh, I might mention, I was pleased that this time you were using 1 page per contract.
Oh,
Which really helped, because when we were running them together, it was kind of flipping back and forth, and where did the previous one stop? And so this really made it, at least for me, much easier to be able to track each contract.
well, I think we can thank Paula Jones, who has joined the contracts office, because that would have exceeded my skills, which is probably why you got it on 2 pages. So thank you, Paula, for
It's okay,
doing good
thank you.
formatting. But yeah, I'm sure it does make it easier. Okay, Civic Edge Consulting. This is an amendment to an existing contract. It is adding 1 year, and it's adding 500,000. And I think under the deliverables-based tasks, we highlighted where the funding was being added. This is for the Living Proof campaign. And you previously approved this in December 2023, and you had some questions about how that the campaign is well received and is there any effectiveness? And so I'd like to turn this over to answer that to Dr. Jeffrey Hom, who's from Behavioral Health Services, who can speak to this.
Great. Thank you, Michelle. And thank you, commissioners, for the opportunity to share about our Living Proof campaign. Again, I'm Dr. Jeffrey Hom. I'm the medical officer for science and policy in the substance use services section of BHS. And as you know, we had a number of goals with this campaign, which is really meant to address our overdose and substance use crisis that we are facing in the city. The goals of the campaign were sort of fourfold, the first of which was to increase awareness that substance use treatment is available and that recovery is possible for every individual. Our second goal was to increase awareness that medication treatment for opioid use disorder specifically is highly effective and available. Our third goal was to direct people with opioid use disorder and or their loved ones to treatment resources. And the fourth was really to promote the city's range of treatment services and work to reduce overdoses. So we were very enthusiastic about this campaign. I think that it was shared by members of the public. And I'm happy to share a little bit about how we've sort of thought about its effectiveness and why we're eager to put more resources into this campaign if possible. First, there was a lot of positive media coverage and community feedback that we received from this campaign. And I won't go into sort of a number of the quotes that we do have, but just sort of I'll quote one from Dr. Gina Frommer, the president and CEO of Glide, who said, I'm so glad San Francisco's Department of Public Health is elevating the voice of people in recovery to motivate and inspire others. It is beautiful to see people reconnecting to their families, getting education, and being empowered to take control of their lives. And so, as you know, this campaign was sort of launched in the middle of November. We had a number of ways in which we were disseminating this campaign and the campaign materials. One of which was sort of what we call the BART station takeover at the Civic Center BART station, where really all of those digital panels that you saw throughout the station were at times simultaneously sort of showing our Living Proof campaign, which I think really adds a lot of weight. It adds a lot of sort of an impressive feat when you sort of seeing this message and the many different faces who were the really talent of this campaign, highlighting these messages, the I'm Living Proof treatment works and I'm Living Proof recovery is possible. We also put this campaign on more than 100 billboards and bus shelters around the city. Really, when we look at a map of where all of these bus shelters occur, it really is in every corner of the city, which we were pleased by. And I hope that through the last several months since the campaign went up in the middle of November, that you've seen some of these billboards and bus shelters. We also had a visible presence on social media, both paid social media and organic social media, which sort of lends itself to things that we post that then get sort of shared with friends and family, or people repost it. That led to millions of impressions. And ultimately, when we put all of this together, we found that there was over 72 million total impressions across the campaign's multimedia channels. And that's a 30% increase above what we expected it to be. We anticipated, based on sort of pre-market sort of the landscape, that we would get about 54 million impressions. So that we got over 72, I think speaks to what we believe is one measure of success of this campaign. And an impression is really sort of defined as the number of times a piece of content, so in this case, our materials, are displayed to viewers. Whether or not it was truly interacted with is sort of a different measure, but it really is the way in which marketing experts use it's sort of the measure that marketing experts use to gauge how widely content is being viewed across platforms. So our 72 million total impressions includes 42 million impressions from the 100 plus transit shelter ads and billboards. We have an estimated 16 million impressions from the Muni public service announcement displays, over 10 million impressions from the digital ads, including those at the Civic Center BART station, and about 3 million impressions for social media. In addition to sort of thinking about the mass media component of it, we also sort of really worked with our community organizations and distributed more than 1,600 posters, all of which are 11 by 17 inches, to more than 160 community organizations around the city. This includes community organizations, substance use disorder treatment programs, OWED affiliated sites, the Entertainment Commission, the San Francisco Public Library, and then San Francisco Rex and Park were all participants in this with us, and have helped put up these posters locally as well. And lastly, I do want to sort of just mention how, again, we also sort of know that was that talks about a little bit about the reach of the campaign and what we think, who we were able to engage by it, but how was it perceived? To understand that, we did some polling. We polled more than 400 individuals, which we think is a representative, and we did so in a way that we think is representative of the San Francisco population. Um, we pulled them towards the end of the campaign to understand, did they see it? How was it perceived? I'm pleased to report that, for that short period of time in which the campaign was launched, from the middle of November to the end of December, more than 1 in 5 San Franciscans reported seeing the Living Proof campaign. 71% of those who were polled understand that the ad was about treatment for substance use disorders, and 54% said the ad caught their attention. Familiarity with the campaign was consistent across demographic lines when we did look at it. The campaign is translated into both Spanish and Chinese. And between public transit stations, social media, and billboards were the most common places that these polled residents recalled seeing the ads. And then we asked, how likely were they to take an action in response to seeing the ad itself? I think which is an important measure of, not only are we engaging someone, but are we moving them towards an action? So we asked them if they'd be willing, after seeing the ad, if it made them more or less likely to visit a website that we have, livingproofsf.org, call a toll-free number, connecting a caller to the behavioral health access line, share with family and friends. And impressively, we found that nearly 40% of viewers reported an increased likelihood to take one of those actions. So we think that was another way in which we found that this campaign was reached what we think of as an intended audience, and is prompting people to action. And so my last minute here, I just want to sort of say that we appreciate the opportunity to field this campaign in the way that we have. We do believe that extending the campaign is important to continue to increase the visibility and reach of this campaign. And so the contract amendment before you that Michelle was just speaking about, we're seeking to extend what this campaign is, really just continuing to post the campaign materials in bus shelters which have the greatest reach in highly impacted areas, while also ensuring that all corners of the city are covered, and then continuing to work with our community partners to increase the visibility of the posters that they have posted in their buildings and workplaces, as well as on social media. So I'm happy to answer any additional questions, but thank you for the opportunity to share a little bit about the campaign.
Thank you, Dr. Hahn, for your very extensive and in-depth discussion of this. And I'll ask my fellow commissioners any questions beyond that. Yes, Commissioner Guillermo.
I appreciate the extensive description of the campaign and its preliminary results. And, given that, it would appear that at least another year, maybe longer, of collecting data on the impact of this program is something that the department and I guess the commission would like to see. So given that this is funded by the opioid settlement funds, I'm just wondering if there has been any consideration of what might happen to the program after the end of this year, because really it'll end by the end of this year. So speaking to, I guess, planning for the future and also the kind of data that will be collected to make sure that the impact that you're preliminarily seeing actually leads to some outcomes.
Yes, thank you, Commissioner, for those questions and points. I would just say that I very much agree that we have a lot to still learn about the impact of this campaign. I think we're heartened by these initial results really over just the first 6 weeks of this campaign. We do intend to continue collecting the same sort of information longitudinally over the course of this year while the campaign is still in the field, both sort of numerically as we've sort of done, as we try to quantify for you in terms of the impressions, but then also continue to engage individuals. How are they perceiving it? Are they likely to take action? And then to your point, well, how are we sort of thinking about at least ultimate outcomes of, are we getting an increased call volume, for example, are things that we want to really sort of begin tracking. We realized it was going to be a little bit early to do so in this first phase, but really sort of tracking now, is the call volume to the behavioral health access line increasing? Are we getting more interest among our providers for people interested in seeking treatment for their opioid use disorder? are all things that we intend to track over this forthcoming year. I think it's will always be a little bit difficult given how many different ways in which the department is trying to address our substance use and overdose crisis, that it'll be hard to always point to one specific thing. But we do believe that this is an important contributor to increasing awareness, reducing stigma, and really ultimately at the end of the day, engaging individuals who would benefit from treatment of their substance use disorder.
Thank you. Commissioner Guggenheim, any questions on this, or shall we move on? Please, let's move on.
Oh, and just a note, thank you, Dr. Hom. I didn't say this when you came on, but when folks who are participating remotely, when you speak, please turn on your camera. It's a rule from the city attorney and the mayor. Thank you.
Okay. Okay, so the next actually the next two contracts are both Health Access Point contracts, which is a fairly new initiative that the department has implemented under the Population Health Division under CHEP section. And Nicole Trainer, I know, is online if you have questions, but essentially the first one, Ward 86, this is an amendment to the existing contract. You've not that long ago, October 4th, 2022, approved this the first time. This contract is adding $323,000 to the contract. The length of time is not changing, and the funding is broken down under reason for funding change, $54,000 essentially each year for cost of doing business increase and increase in the contingency. So, anyway, it's just continuing the program and adding this money to it. If you have additional questions about this one, I know you have questions about the next one, but if there's anything on this one, happy to send it to Nicole.
Any questions to Ward 86? Yes,
Just,
Commissioner Guggenheim.
sorry, just on the monitoring report for this one, there are no category ratings that are listed, and also the review period is back to 2023, so I'm just wondering if there's anything more recent.
22, 23?
Yeah.
Okay. They go in cycles. So when the end of COVID started, we converted back. During COVID, we stopped doing the scoring, like putting the numeric scores. We still went out, monitored, and wrote up the findings, like you met 40%, you did this and that, but we didn't do the numeric scores. And then we switched back. CHEP, the Community Health Education and Promotion, I hope I got that right, section, they delayed the scoring of their contracts because they were so the programs, because they were so heavily involved in COVID response, and their tail kept going. And so that was why that doesn't have the score. Let me look. I think we ask every time, like, is there a more recent monitoring report? And I think it's not done, is why you don't have it. But I can find out it, or unless Nicole's on here, if there's any. We don't have any, nothing came up as a red flag, and they traditionally score super well, which they did this time, or, described as not number score. So I can come back and tell you if there's any.
No, that's fine. I
Okay.
just, it was again,
Yeah.
because it's different from the other
Right.
reports and it was older. So
Right.
that's reasonable explanation. And then we expect that the next monitoring report will
Right.
be on time
Catch
and
up, yeah.
we'll have the ratings. Okay.
Right. Okay, so the next,
Is it okay to move on?
Yes, I'm trying to decide. It looks like you were speaking about the not Ward 86, but the
Yeah. it was-
AHP Health Access Point one for the Asian Pacific Islanders,
No, it was.
because that's the one that's not scored. Ward
Oh,
86 has
yeah,
scored.
sorry. That was, yeah, you're right.
same explanation. I wasn't looking at
Yeah.
I didn't actually bring those with me, unfortunately, but that would be, I looked it up actually, wondering when and why.
But the comment
Right.
was appropriate anyway, that we understood.
I got
during
ahead of myself.
The height of COVID, we did suspend the scoring, so. Did you go on to the next
You
UCSF
ready?
contract?
Okay, yeah.
Yeah.
So the next one is Alliance Health Project, UC. Again, this is a health access point contract that provides testing and HIV prevention and sort services. And it's while building a hub for community engagement, involvement, leadership development, and community building for at-risk API populations who are often disengaged from a larger sense of community and who lack access to resources that cross traditional boundaries of language, nationality, et cetera. So for this contract, I'm going to give you the answers that Nicole gave, and then she's here. But one of your questions was, I think your first question was, what's the reason for change? The additional 216,432. So what they, as I just said, these are comprehensive programs. So they had some other programs in the division that were Alliance Health Project HALT program. I'll see if it's spelled out, and / Access Hope Mental Health Services programs that were in a different contract. And they realized that these services were completely in support of the health access point. And so they pulled that funding and those contracted services into this new contract. So that is that increase of the 216,000. And then you asked, what is being counted as unduplicated clients of 54,000? That actually is, well, it's two errors. One, it should have been 54,000, but it's not shouldn't have gone under unduplicated clients. Probably it should have been number of contacts, which is another choice that the analyst can make when they choose. And so it should have been number of contacts and not unduplicated clients. But what they did, that's the count of the distribution of at least 50,000 condoms annually among the supported program. So that is what that, and I won't even comment, but.
Well, we had one more question, that your community engagement and mobilization hours
Yep.
worked out to be $588 per hour.
Yeah, so what they do, and it's hard getting ready in time for the Monday meeting and get the answers because we collected them, but to get them back to you by Monday, so we can send these after, and apologies. But we did get a response, and the program provides right. So I told you the part about like they're bringing it all together. So the program provides the below community engagement strategies to effectively reach API communities. So there's like 8 bullet points of things that are all in this, that cost. So there's stipend leadership opportunities for API community members who support project volunteers and help organize and coordinate project outreach and recognition events. There's also regular weekly drop-in testing and support programs specifically for API individuals. There's on-site HIV, HCV, and STD testing and treatment. Community-based mobile testing van operations, peer counseling session support group. This is some of them. I think I'll let Nicole respond and explain and make sure that everything I just read was part of the community engagement rate, but that is what I believe it to be.
Yes, Michelle, thank you. That is correct. I also want to clarify that $588 an hour is a cumulative of services that are happening simultaneously, right? So it's just not 1 hour. There's multiple things that are happening within the organization. Michelle, you mentioned that some of our, social media presence and engagement that enhances the online peer messaging. They have peer counseling sessions and support groups that are offered during regular business hours, and they also have drop-in hours that are later in the evening. They also have support groups that are trauma-related support groups that are really designed to overcome isolation. It helps individuals with the API community deal with feelings of shame and stigma, and also to confront trauma and also enhance some self-protection behavior. So it's some behavior change support. There's also 12-step group sessions for folks who have substance use issues. We have wellness education workshops, and this particular program also sponsors monthly outreach and awareness events that are related to specific API ethnic populations. And one of the highlights of this community and engagement efforts is that we, as that AHP has stipend leadership opportunities, and they offer specific API community members leadership opportunities, which they support projects and they support the volunteers that help organize and coordinate a lot of the outreach events and strategies as well.
So it sounds more like we probably need a different way of describing this than 400 hours, which gives us a very odd number.
Yeah. I was going to say, I'll circle back with Nicole and look at the contract and see if we grabbed it in a shortcut and that's not how, or if there's another way to show it that is more
Yeah,
explanatory.
I think it's a
Right.
matter of how you show the services. I mean, if you had maybe put it as, just as you described,
Right.
that's what the program does, and then divided by a monthly amount or something like that. That would have been
Right.
less confusing than saying there was 401 hours that were
Mhm.
calculated.
Yeah.
Mhm. Yeah, Michelle,
Yes.
we'll have to take a look at that
Yeah.
to
we
see
can
how we
follow up.
effectively capture all these strategies in one modality.
Okay.
Okay. Any other questions on that one? If Commissioner Guggenheim, any particular?
No, I do think it's important that $588.35 an hour be somehow either changed or broken down or
Or grouped a different way.
Yeah.
Right. I mean, it could have been monthly cost or something like that for an entire program.
paying $588 an hour for something that's not really true. And would be too expensive.
Yeah, I'll look at
Well,
that.
that's
We'll look at
good.
how the
Right.
contract looks.
Okay, let's proceed then on to our next item.
Okay, the next.
Next contract.
Yep, the next contract is with Positive Resource Center. And this is it's an original agreement to continue existing services. The change is to add the funding. The contingency supports the funding for 3 years and 1 month. It is a contract that you have approved many times in the past. It pays for the Equal Access to Healthcare program and the Transitional Residential Care Facility. So it provides services to people that live at the Transitional Residential Care Facility, which is called Leland House. You had a question about the finances of the program, and did I forget? Oh, wait, sorry. Sorry, I think it's on a different piece of paper. Okay. Okay. So okay, sorry. All right. Question about the finances. How are they doing? So as we indicated in the annual monitoring, that's fiscal and compliance monitoring done by the city under the controller, that they're good, they're in good shape. They had no findings. And then the Business Office of Contract Compliance does does an additional audit of their financial statements, and they would have put them as low risk because that's what was indicated, except that because of their past history, they were put at moderate risk so that they could continue to be looked at. But in terms of the update, which was really your question, like where are they now? Currently, the department has received financial results as of the third quarter of 23-24. So that's as of March 31st, 2024. And these results were positive with a surplus in net income and working capital above the city's standard of 1. And then we also hold, not me, but we, the business office and fiscal, hold regular check-ins with the agency, and there hasn't been any red flags noted. So typically, agencies require about 6 to 9 months following the end of the fiscal year to close out their completed audited financial statements. So we're expecting 23-24 to come in no later than March 31st, 2025, and therefore the citywide fiscal and compliance team has scheduled their annual review to occur in April of 2025. So right now, there's not a further update, but there's also no further concerns that have been raised. So when they get those audited financial statements, they'll conduct their next audit, and we expect the completed update by May of 2025.
Okay, commissioners, questions on the Leland Health Program?
Just a comment on, because we had so much concern about PRC prior, this is an example, I guess, of the department working very closely with an
so.
agency that's been, of concern for a number of years, and has been able to sort of help that agency become more stabilized. And we hope it will continue. So just commenting that this is just something
Yeah.
that shows
Mhm.
the interventions were, or at least for now, they're
Yeah.
working. So appreciate
Yeah,
that.
a lot of staff in the department, Wasim Samar, be here, and then fiscal and the city too, the controller's office. So yeah, big effort, but it's been good.
I did have a question about this first contract. It says that it's an original agreement for continuing services. When did the current contract end? Because the new contract doesn't start until March 1st.
Yeah, so it probably ends 2/28. It probably hasn't ended yet.
Okay, so, but there's nothing under it says NA under current contract.
Oh, you know why? Because it's the formatting. They don't, when we do if we do a new contract, it like technically starts with the new contract. So when we do this format with a new contract, we put in the proposed, we only put in the proposed, but we share the prior annual amount for just comparison purposes. We didn't share the prior term because then it looks like it could be an amendment and not new, but that's why it says that.
It's just
Yeah.
a little misleading. I mean, I know it's you've done this before, when it's a new original agreement for continuing services, but
Yeah.
I guess it just gets a little misleading when it says continuing services and there's no current contract listed. So I don't know, some asterisk note or something
Okay.
would be, yeah. And just going into the future.
Yeah, I think if we're moving forward, and this is nice, this one's not retro. It'd be nice to have known when the last
Yeah.
contract ended. So
Okay.
just like we do have, which is wonderful, the prior annual amount without contingency is put in there,
Right.
which is very helpful. So I think in general, you filled out that block. We should see it. The
Well,
block there. You
yeah.
filled out if this is a continuation.
Well, we fill that block out if it's an amendment, but let me figure out, but what we write into this, as I say this, hoping it's there, but what we always write in is that the prior annual amount is just shown for comparison purposes, but we can do the same
Yes.
for the current
no, I
contract
think
term, but
that's
then
fine.
it does make it look like an amendment. But I hear your concern.
Okay. Uh, We'll move on to our next contract.
Okay. Okay. The next three contracts are all with Instituto Familiar de la Raza. These are all three examples of original agreements that are from continuing. They were all part of the same contract. And there was more programs, and one went out to bid. So that opportunity just was how come these are all in individual contracts. So the first one is the older adult behavioral health behavioral health services system of care, older adult outpatient program. So this is ongoing, continuing program. These contracts, these are contracts. Some of these are the one I was talking about where we used the old so we could get it certified. So they had cash flow. This one, been working really hard with Instituto to get their CalAIM rates up, in that template and understand and work with them on cash flow and all of that. So the first contract is the older adult. I don't know, do you want me to talk about all three together or one at a time?
I think it's best for notes for
Okay.
in the public.
Okay, so the first one is Instituto Familiar. It's for the older adult program. There is no change. It's providing outpatient services. It retained its same solicitation authority because it just moved from one to another. And the delays in this contract have primarily been the result of CalAIM, really, just getting that
But you can certainly ask.
template into place. I don't think there's other changes. And the other ones that we'll talk about, there was some program combining, but not this one. So this contract, you had asked about, or you were looking at the monitoring report objectives. And so we have staff here to speak about that. But in general, IFR's had some issues with getting their data captured accurately, but they've submitted a plan of action, which the adult system of care has been working with them on since January of 2025, actually, to work with them on the data. But I'm going to turn this over to Alex Jackson, and he can speak directly to that question about their monitoring reports, which really is focused on the adult one, I believe.
Yes, hi everyone. Good afternoon. Yeah, we've been working closely with their program director, who's been working with their staff on accurately capturing the data. So there was a little breakdown in terms of them being able to train their staff. Now that we're on Epic, a lot of the things that they'll be monitoring is going to be much easier for them to do. So we look forward to much improved capturing of data. And actually, one of their areas, it was really just based on one client that a particular record was missing. And when we look back and look forward, that we'll be able to much better monitor them with the new Epic system. So I don't know. Are there other questions that I could answer?
Thank you.
Commissioner Guillermo?
So is the scoring on the performance objective, a program performance of 1, is that primarily because the data was not being collected? Are there problems with data collection, or were there problems with actual performing the services?
Oh, no, it wasn't really about performance. It was that on one particular item, it was just one client. So there wasn't really sufficient data to really evaluate it one way or the other. And some of data that's captured in Avatar that I'll take the assessment, for example, that with CalAIM, we've integrated our ANZA, which is one ANZA items. It's the adult and needs strengths assessment, with the CalAIM 7-domain assessment. So rather than having two different assessments, now you just have one that's integrated, and it's much easier for us to evaluate that. The other data that was captured was, or difficulty capturing, is making sure that all staff are trained to make sure that when we're referring someone to a psychiatrist, that the date that the referral is made and the date that they actually see the prescriber, for example, is entered correctly. So those are a couple of areas where we'll definitely see improvements because we can capture the data.
Thank you.
Commissioner Guillermo, I mean, Commissioner Guggenheim.
No, I'm fine.
Oh, okay, that helped answer that question.
Yes.
Okay. We'll go on, let's go on to the next contract. I think dividing into three, because the city attorney said we have to divide them up. It's appropriate to take it up as each separate contract.
Eventually, I mean, this is a heavy lift and it adds a lot more contracts, and hopefully we'll have our electronic system to help us keep track. One thing that it does do, though, when some of them really got big, and with different programs, you have different business owners, and then one change here can delay this. So I think in the end, it's not terrible. It's just doing it is like getting there is hard. So there's a silver lining, at least. The next contract is a behavioral health children, youth, and family contract. And this one is combining, it's got two programs. It has their full service partnership and their intensive supervision and clinical services programs that are, again, this was part of the larger contract, and now it's a breakout. So these are intensive services, case management, wraparound services, and I think it's all the same. The difference is, and I know this is outstanding, and so I'll bring this and it will be more eloquent, but the change in the outpatient rate is going to look different to you because what you're used to seeing is minutes. And so it looks like $1.50 a minute and it's 1,000 units. So now the home setup is looking at hours by clinician type. They each have different rates. Those are all melded, added together, and it comes up with a blended rate. And then the units are assigned against the hours that are, it's a formula that is calculated, and then some back and forth with the agencies. So that was not eloquent, and I would put that into a paragraph because that's going to be coming up over and over again. And it's also going to impact what we're able to monitor in terms of units of service in fiscal year 23-24, because we're shifting. And so we're not measuring the same thing, and we don't have historical data. So I'll have that explanation. But here they've made an attempt to show you what not made an attempt, they did it. They showed you what the hours were going to be. And then the expected unduplicated clients. And again, this is a very intensive program. And I believe their business owner, Farah, is on the line if you do have questions about this.
Yes, Commissioner Guggenheim.
So I'm kind of new here. I noticed the report date is September of 24, but it's for the year of 22, 23. Is that right?
Oh, the monitoring report. Yeah, the monitoring report. So that's late, but the monitoring report happens during the year after. So they're doing 23, 24 right now. So ideally you could have had 23, 24, but it doesn't even start until the year's end. It's not real time. It's trying to take a snapshot of all the compliance items so we have a historical measurement over time. But that's
So how
Why?
out of date then?
how out of date.
Like if you were to look at the new report that will come out, will the data be more or less the same what you have in 22, 23, or what do you think?
The data, the performance measures haven't changed that much in the last, like historically. I think there's going to be a reset starting with the 23, 24 monitoring cycle, which they're starting right now for behavioral health services because of CalAIM. And for, if you're at least for outpatient programs or residential where you enter your units into Epic, that's going to be a change, and it's going to impact some of the current performance measures. There's also work underway to evaluate the performance measures across the board to maybe realign them to look more at outcomes and what's measurable out of Epic. So there will be a reset, and we'll try to get all of that into a place to share. But it's sort of rolling out now. I think, yeah, so 23, 24 will show changes when they start coming, and then 24, 25, they'll start to be historical data. So I think that's where the reset, if you will be in place, and you'll have more comparative backwards documentation.
Thank you.
And commissioners, I'm noting we've got about 20, 25 minutes until we need to start our next meeting.
Promise not to ask you more.
Hey,
You do.
the
Commissioner.
Just
Go
so
ahead.
then, given that, would we be able to get sort of an orientation or something that might give us then the context for the
Yeah,
reset?
I
So
think,
that when we look at the monitoring reports from
Totally.
that point on,
yep.
we have some sort of marker that things have changed.
Yeah, I'll follow up with Mark, Mr. Morowitz, about that. There's lots of presentations that have been done for the providers and our own staff, and I think we can tailor it. And we also will have more knowledge about the impact, because a lot of it is just making decisions about how we're going to manage in the interim. So, okay.
Yeah, mine may not have been quite the same, but the units of service therefore really needs new definition from the way that we're
Okay.
talking about here. So we'll look forward to a better explanation at a different time.
Yep.
Thank you. Let's proceed to the last contract.
Okay, so the last contract is again, Children, Youth, and Family Behavioral Health Services, and this is breaking apart into its own contract, their outpatient program. They retain their original solicitation authority. This is an original agreement for continuing services. And I don't think that there's much change except for the fact of the reconfiguration of the rate as part of CalAIM.
Okay. Any comments? Yeah, I think in general, it looks like Instituto, and what you're saying, if it's more a matter of data and appropriate documentation, then we're understanding that this is now underway with the transition.
Yeah, and I think the children's programs, they all, like one scored a 3, met objectives, and I know one of the sections had a lower score. I didn't look into that lower, I mean, in one of the 4 components. Overall, one exceeded standards and one met standards, but yes, in general, documentation and also staffing issues, and I think as the vendors are able to get staffed up, that helps as well.
Okay, so I think if there are no more questions on the contracts, was there public comment on this section?
There's no, actually, is there any public comment in the room on this item or on the contracts report? And this is the Finance and Planning Committee meeting in case some folks are here for the full commission meeting. Anyone? All right, there's no public comment.
All right, thank you. So we need a motion to recommend to the full commission, unless you all don't want to recommend to the full commission, the approval of the contracts report.
I'll move recommendation of approval to the full commission.
Second.
All those in favor?
Aye.
Aye.
All right, thank you very much, Ms. Ruggles, and everyone who provided comment. We can move on to item 4, request for approval of a new contract with Datix USA Incorporated.
Good afternoon, Commissioners. My name is Emma Moore. I'm the Director of Regulatory Affairs at CSFG. I'm here today to discuss the contract request for Datix USA for policy and procedure management software, which is known as PolicyStat, including their accreditation and regulatory modules. And just to clarify, this is actually for the San Francisco Health Network, not just for CSFG as it appeared on the agenda. So our current state at the Health Network is a variety of homegrown SharePoint pages, paper systems, you name it, that's how policies are being tracked. Some of which I can at least say for CSFG, there's not a consistent search bar at the top of our policy such that it can make it very challenging for staff to find them when they need to pull up a relevant policy. And purchasing this software will allow us to provide continuity and consistency across the Health Network such that people can share if there's a relevant policy that 4A SNF at CSFG needs that Laguna Honda can share or vice versa. This will also allow for interoperability with our existing RL Datix RL6 event reporting system, also known as the SAFE system, if you're familiar with that, as well as the patient feedback system that we currently have in place. And this is a separate agreement, a separate contract from the one that brought us that event reporting system, but they do have, we will be able to integrate them so that policies and relevant regulatory standards can be pulled in and cited during, like if the event report, an event is being investigated, they'll actually be able to attach that. So it's all one, it should function all as one system. And of the questions and comments I received from the commissioners, first, it was noted that this was the third highest bid. And I was not personally involved in the RFP process, but my understanding is that due to the city requirements for vendors, they were unable to come to an agreement. That being said, I think that's a notable upside of this is that we have the existing event reporting system through RL, and that interoperability is a unique opportunity we would not have had with any other vendor. The other question had been what other facilities are using this product. I can share that there are over 3,000 healthcare organizations worldwide using this. My personal understanding of it is RL Datix is in the process of becoming the Epic of kind of quality management systems. And the most relevant other user would be UCSF. Our very own anesthesia and respiratory departments at CSFG already have their own kind of version of this through UCSF. And so I'm also hopeful there will be some existing knowledge from relevant UCSF employees, medical residents, et cetera, where they're familiar with the system. Other clients of theirs include UC Irvine, UCLA, University Hospitals in Ohio, the University of Michigan, the State of Maryland Department of Health, Scripps Health, and Peace Health. And I imagine there may even be some other higher profile clients that the vendor could share, though I'm not sure that they were able to log in today. So with that, I will pause and ask for questions.
Is there public comment?
Is there any public comment on this item in the room? We're on item 4 of the Finance and Planning Committee. I see no hands, no public comment.
Okay, commissioners, Commissioner Guillermo.
One, I'm really glad to hear about the opportunity for having a contract like this. When I know that I just on the Laguna Honda side, the avalanche of policies and procedures that that sort of come to us every month is quite large. So to know that there's going to be some sort of uniformity or something more technology based,
Yes.
is hopeful. And hopefully this is the right solution. My question has to do with the software license. Is this a one-time purchase of the license, or is there going to be or both of these licenses actually? So
So
will
it's
there be a
it's one-
renewal or? Yeah.
Sure. So there's an implementation fee that is specified out in the cost, and then it is an annual an annual service, essentially like a subscription, if you will, that we pay them on an annual basis. So this contract runs through January of 2030. And then we would be able to renew, I think, for whatever the contracts office, whatever duration, provided that the contract has been sufficient. But it is it's an initial implementation fee and then an annual service-based fee after that.
Now that you brought up LHH, why is this not also for LHH and under the entire network? Because it says only for.
It is. So this is for the entire health network. The agenda I think because my name was attached to as the presenter. But this is for the entire health network, which very much includes Laguna Honda.
Okay, because the title says at Zuckerberg.
The contract says, I promise, I checked it, San Francisco Health Network.
All right, so
I'm given language by the business office, and I cut and paste and put it into the agenda. I'm not sure if, so we'll go back and check to make sure that the contract document is amended because, this is a lot of people just taking it and cutting and pasting along, cutting and pasting. I'll check with the.
okay,
business
yeah,
office to
check
make sure.
for sure because something like this exactly should be available across the network.
Absolutely. And I think our intent is very much to kind of provide the same coverage that the SAFE system, which again has kind of been a staggered rollout for those of you involved with Laguna Honda. That's been a more recent thing, but it will be able to provide similar kind of collaborative coverage throughout.
Okay, well, now that sounds more like a bargain. Does that mean we won't have to read all those policies? No, I didn't get that as an answer. Okay. Commissioner Guggenheim, any questions on that?
No.
Okay, so then I guess if there was no public comment, huh?
Then we need a motion to put
Yeah,
this on the
Right,
consent.
we need a motion to recommend this contract to the full commission.
I'll make the motion to recommend to the full commission.
And I'll second it.
All those in favor?
Aye.
All right. Thank you so much, Ms. Moore.
Thank you.
Item 5 is emerging issues. Is there any public comment on this item?
I think we
Commissioners?
brought up emerging issues already during
Yes,
the
of
meeting.
course. And then general public comment, item 6, so again, we're at the Finance and Planning Committee. All right, none. And so a consideration for adjournment. Please, commissioners.
Is there a motion for adjournment, please?
I so move.
Okay,
I'll second.
All those in favor?
aye.
All right, please give me a minute to log us down. But thank you everyone who watched and participated.